Welcome to Aging Untold. If you're approaching age 65, here's something you'll want to know more about: Medicare. Roughly 67 million U.S. adults are enrolled in Medicare coverage. That's according to the Centers for Medicare and Medicaid Services 2024 data. And while we know it can be confusing, it is one of the most important health decisions you'll make. So we're tackling it piece by piece, starting with Medicare Part B. Amy, what is it and what does it cover?
Oh, I'm holding my breath because people just panic because it is complicated. So you get a little red, white, and blue card. And on your card, it says Part A, which is hospitalization, and Part B is everything else medical. So in that B, you have medically necessary and you have preventive health. There is, confusingly, in another show, hopefully we'll be explaining the other B. We're only talking about your Medicare B coverage.
Your straight Medicare, not your
Medicare.
supplemental.
Correct.
Your straight Medicare.
Correct. So in that, you have under medically necessary, I think, Sam, you've got some great examples that you've experienced, but ambulance if it's necessary,
Right.
durable medical equipment, labs, x-rays, all the extra medical stuff that you need is covered under B.
So the doctor's visits, is that the preventive part?
Yes.
Okay.
Yes. Good question.
Yeah.
Okay.
Yeah.
Well, all I'm going to agree with is that this is very confusing. And I have been in the aging space for a while, and I'm just going to say every time I'm going to phone a friend, I know who the Medicare specialists are and who I trust to answer my questions and who I trust to send people to. And so local. You want to have someone that knows you, you know them, you meet with them face to face, and you're getting help figuring out these different things.
I have been in the space forever, and I still refer people off to the people that do Medicare. But what it does cover, let's roll down the list. Doctors and other services, so office visits, specialties, telehealth and outpatient visits, outpatient care for outpatient setups, right? An outpatient surgical facility, the fees there, many preventative services, screenings, vaccines, wellness testing, clinical lab testing. Your images and diagnostic testing are covered here. Your mental health and substance abuse can be covered here. Ambulance services, durable medical equipment. So if you need that walker, that wheelchair, that oxygen, your hospital bed, that's where it gets paid for. Home health, not home care. And this is what confuses so many people in this industry is they think, oh, I get a caregiver. No, you can get a bathing aid through home health if you have home health on board. So if you need physical therapy or you need a nurse for a wound care or things like that, then you can tell that home health agency, I want a bathing aid as well, and they can provide that in conjunction. They can't come in and fix your meals. They can't come in and do your activities of daily living. So limited outpatient prescriptions can be covered, and that's like your infusions, those kind of things. And then the ones that are kind of really obscure, our clinical trials can be covered, and diabetes prevention programs, as well as medical nutritional therapy. Those can be covered through this, but there are a lot of things that people think Medicare covers, and you're like, nope, it doesn't cover that.
And even within the Medicare, I know that they still have guidelines on some of the doctor's visits. I know for gynecologists and all that, the guidelines like the pap smears every other year.
Right.
You know, and different things like that. So you have to go the guidelines within the guidelines.
Right.
So from your perspective, having older parents, Medicare.gov, if I say it once, I'll say it 100 times, Medicare.gov, especially the preventive health area, preventive screen, they have an introductory to Medicare visit that you can get, and you can see, these are the kind of things that I'm worried about that I'll get. Does Medicare cover this preventive screening and supply for me and my specific diagnosis?
Right. And again, I will go with it all day long. There are people that specialize in what Medicare covers, what it doesn't cover, how to enroll, when to enroll, because there's also, if you don't enroll on time, kind of stuff that goes with the supplementals and things. So you You
get
do
penalized
need
for life.
You do need somebody that can help you and guide you through this. All we're going to do is give you the information, and we can go over later what Medicare doesn't cover, because I think that list becomes a little longer, and it is really confusing. And people get really frustrated because they think that it should cover this. Well, why doesn't it cover somebody to
Yeah.
come in and help me in my house?
Right. I think if you're 64, the rule of thumb is start doing your research. If you're still working, do your research, because your current insurance might be fine until you decide to retire. If you don't decide to retire till you're 68 or 69, you need to understand if your insurance is approved by Medicare to get Medicare A and B. So the 64 to me is the magic number to start researching and take that time to understand your current insurance, what Medicare is going to cover, and what kind of Medicare insurance you want to purchase.